Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And this month, the month of July, happens to be National Minority Mental Health Awareness Month. And so, as you can see, minority represents a lot of different populations. So, BIPOC, African American populations, individuals that are LGBTQ individuals that are different types of minorities, maybe if they're immigrants or undocumented workers. So, this is mental health for all of these minorities. So, let's go and get started here. Some things that I wanted to go over is four or five things that the month addresses. So, um, there's unequal access to care. Racial and ethnic minority groups are very much less likely to receive mental health treatment and more likely to receive lower quality. Also, stigma and discrimination, cultural stigma, racism, and mistrust of healthcare systems. And this is a big deal when you're thinking about not only in the U.S. but in other countries. There's a lot of stigma with associated with mental health. Of course, historical and intergenerational trauma, and this specifically includes Black individuals, but can also include Indigenous and immigrant communities. And I kind of went over that at the beginning. So then last but not least, shortage of culturally responsive providers. So you're needing language translators that can actually make things more difficult to understand than economic and structural barriers. What is important to note is 25% of US adults, one in four, lives with a mental illness, myself included. I've gotten a lot of diagnoses in mental health, but minority groups receive less treatment even though the symptoms are similar. Black and Hispanic Americans, they're less likely to access therapy or psychiatric treatment. And that may simply be due to cost, provider shortages, or insurance barriers. Asian Americans are 45% less likely than US adults overall to receive mental health treatment in 2024. And then finally, serious mental health illness prevalence is highest among individuals reporting two or more races, followed by American Indian, Alaska Natives. So how did we come up with National Minority Awareness Month, Mental Health Awareness Month? Well, B. Moore Campbell's, she advocated for this month to happen, and she co-founded NAMI, Urban Los Angeles. And NAMI is a very it's a national organization that looks after the rights of people with mental illness. Um, Her work also went into stigma and lack of culturally competent providers, isolating families of color. Um, in 2008, this month was uh, devoted to and recognized as Mental Health Awareness Month. Um, Key themes, so integrating social determinants of health and historical context into mental health programming, using culturally and linguistically appropriate communication. For instance, health literacy, even though the health literacy is supposed to be only until 8th or 10th grade education, a lot of times the pamphlets and visuals are a lot more advanced than what the average individual has. Um, so if you go deeper, there's a lot of epidemiology and public health. So I urge you to go in and do a search of National Minority Mental Health Month and take a look. Um, this is looking at all races, this area, and then the text crisis text line is 988, and 988 is for Suicide and Crisis Lifeline. Um, probably in a different video I'm going to show this, but this is a very good website to use when it has to do with minority mental health. I hope this has all made some sense. Thank you for listening.